The road that brings people to addiction is different for everyone. Some people start using because they were hurt by someone or something. Others, because they were lonely or hopeless. Still others were just having fun until they weren't anymore. No matter how your use began, no one starts out thinking it's going to end in the pain and suffering of addiction. People start using and keep using drugs because they believe it solves a problem for them. But use turns into addiction when it causes more problems than it solves. In your addiction, you figured things out and you did things you needed to survive. But you're with us today because just surviving isn't enough for you anymore. You want to thrive. You're a fighter and a survivor, and we respect you for this. All of us at BHG are here to help you attain your goals. We're glad you chose us to be your coach and your guide as you walk the path toward recovery. It's a path that tens of millions of people have successfully walked, and you have it in you to be one of them. What we're seeing today is really kind of without precedent in US history. The number of people dying of drug overdoses is truly an epidemic. We're losing over 100,000 Americans a year to drug overdoses, and 70% of those are related to opioids.
The opioid epidemic has no boundaries. It cuts across socioeconomic categories. It cuts across age categories. It cuts across all demographics. Certainly more vulnerable populations. There are about 7 million people who have opioid use disorder, and only about 15 to 20% of people are getting access to treatment.
At BHG, we care about addressing this crisis, and we've devoted our lives towards studying the science of health. Everyone has their own recovery journey, their own recovery goals, and their own recovery experience, but they'll see marked improvement when they're in treatment.
Once they get into treatment, that's where our job is to help them maintain that hope that things can be better.
At BHG, we are so proud to be part of a solution that is restoring people's lives and starting to get them on a path to recovery, while also limiting the destructive effects of opioids.
The biggest thing that separates what we're doing with the rest of the industry is that we ultimately hold ourselves to a higher standard in opioid care. Everything from our Joint Commission accreditation down to our evidence-based care models to just the whole patient approach.
It's important that we meet the patient in their unique journey of where they are in their recovery.
You know, it's not enough just to get a pill. Getting stable in your lifestyle, getting stable with your health, enables you to begin to do the often difficult work to figure out how you got into this position to begin with.
The integration of medication-assisted treatment, behavioral health counseling, as well as intensive case management services is the true evidence-based model.
Luckily, we have decades of research of what works in treatment and what doesn't work.
We've been very focused on taking the evidence and our comprehensive approach to treatment and scaling that in a modern healthcare infrastructure so that patients have access to the quality and have access in their communities for treatment.
We treat over 42,000 patients every day. So I think that having that scale really allows us to identify those best practices, and then we leverage that across the country. It really elevates the level of care for opioid use disorder and all addiction. The one thing that I think about often, and I hear from our patients, is that many doors have been closed to them through family, friends, or communities. And so I'm proud of the fact that our door is open.
BHG strives to reduce and remove financial barriers to treatment. We're in network with most major carriers, Medicare, Medicaid, commercial.
We're here for recovery, right? I mean, nothing is more gratifying than helping somebody who's looking to get their life back, to help them make progress towards that goal.
There's a deep sense of purpose and deep sense of connection to the mission that really drives the way that we care for patients in our centers.
At BHG, we're all united around our mission and our values. Our values of hope, respect, and caring.
It's such a powerful mission to be a part of, to think about transforming really a community for generations to come.
When we say treatment, we are talking about helping you gain the knowledge and skills you need to recover. Treatment teaches you about the brain disease of addiction and the substances that cause it. It teaches you about how your brain and your mind change over the course of addiction and how to let it heal and change back. Treatment teaches you how to identify triggers that could lead to relapse and how to avoid them. And for those times when risky situations just can't be avoided, treatment teaches coping skills to get through it without relapsing. Treatment includes the counseling you get with a counselor, either alone or in a group. It also involves getting connected to the physical and mental health care and other services you might need to heal.
So it started out with a doctor prescription, and then when that got cut off, it went to street drugs, and then it went from street drugs to once your tolerance gets so high or you can't find what you need, you find whatever you can just so you don't go through withdrawals. I could barely wake up and take a shower because I had to wake up and use. And if I didn't have something to use, it was waking up to find something to use. And that would have been calling whoever, trying to make deals or whatever you have to do to find that drug, just to be functional. The turning point was I had nothing left. I had lost everything except my son. I still had my son, but I had lost everything in my life. I had lost my home. I had lost stuff that I had worked so hard for. A friend had told me about the behavioral health group with the help of BHG and all that they have to offer with the groups and supports and counselors. They were able to show me the ropes and give me guidelines on what I need to do, the steps I need to take. All the staff members, the nurses, counselors, everybody has been so welcoming. I never felt like I was less than. I felt like I was wanted. I felt like I was here for a purpose, and they will help you, they will care for you, and they will love you in the process. Even if you don't love yourself, they will love you until you do love yourself. If I missed a day, they were always checking in with me. I couldn't ask for a better team. I really could not. Everyone here has been amazing. I love them so very much. Your drugs are your best friend at that moment, but they don't love you, and they never will. They won't be there to help you. They'll be there to keep you down. Addiction can happen to anybody. Doesn't matter who you are, addiction can happen to you, but it's never too late. There's always treatment, and it's out there. You can get it at BHG.
Addiction can take many things from people: their family, friends, jobs, their physical and mental health, and their freedom. For some, addiction takes everything. Stopping drug use is just a piece of recovery. Simply not using drugs won't get back what you lost. Recovery is about getting back what was taken and then getting more. It isn't about not doing something, like using drugs. It's about actively doing the things that help you live a full and fulfilling life. To get into recovery, people need treatment.
I actually broke my foot coaching football. That introduced me to pain pills. The euphoria I felt off of that first pain pill was unlike anything I'd ever had. So I thought, well, if one makes me feel this good, how good will two make me feel? Before you know it, that 2's 3, 4, and then you can't get your pain pills, so you're out on the street trying to hustle pain pills. I worked in youth sports, and I loved kids, and I lost my job when I embezzled money. I'd had a heart attack, about 5 stents, my health was just terrible. I was homeless. I've slept on the park bench, I've covered up with cardboard, I've been robbed, beat, I've had my teeth knocked out, I've had everything stolen. I began to realize my daughter came to me and told me she was pregnant with my grandson. She said, "You will not ever see him if you don't change." That was a turning point in my life. That was when I said, I'm sick and tired of being sick and tired. What can I do? That's when I got on the Suboxone program. And the very first day that I took Suboxone, I never craved wanting another pain pill in my life. They all can write prescriptions. They all can give you the medication. That's not why I'm at BHG. I'm at BHG because they give me the medication that you can't write a prescription for. They made me feel like I was somebody again. My recovery began when I walked in that door. Came here every single day. I came to counseling 2 and 3 times a week, sometimes 2 hours at a time. They made me feel like I really mattered, and that's the reason I come to BHG. And I would say to anybody that's in a program and you don't feel like you're needed, you don't feel like you're wanted, please come and try BHG. This place, going into rehab, having good counselors, and a good support system saved my life. If you can get in that door at BHG, I can promise you your life will change. If you're committed and you want to recover, I promise you, if you come in that door and you're committed to this, these people will help you and your life will change.
Our integrated dynamic care model is kind of based on the idea that that opioid use disorder and substance use disorder in general, they're spectrum illnesses, meaning that there are going to be mild variants, moderate variants, and severe variants. It's also based on the idea that these are chronic conditions and that people live with them and manage them over time. And it's also kind of predicated on the idea that slips and relapses are kind of an expected part of anyone's process in getting to a recovery. What we try to do is put the patient at the center of this and make allowances for the fact that there are going to be differences between individuals and what they need to help them, but also in the same individual over time, that there are going to be times when their needs are more acute and times when they're going to have fewer needs. And so what the goal has to be is getting them connected, having them connected to care over time, and to be able to change what we offer based on what their wants and needs are.
I'm Nicole Ross, the Regional Director for North Carolina, South Carolina, and Georgia. I come from a family who had a long history of substance use and a long history of not talking about substance use. And so I think the prevailing thought in my family was that if we don't talk about it, it will go away. That was not the case for my brother or myself. I lost my brother when he was 25 of unintentional overdose. That was kind of the impetus for my own recovery journey and why I do what I do today. I started using substances really recreationally in my teens, and then by my 20s, it had taken a firm hold. When I got pregnant with my daughter, that was my wake-up call. I reached out for help and assistance and was told that there was a 28-day waiting period. And in that 28 days, I ended up with charges that now follow me forever. And so I always tell folks in my region, like, think about that. Like, you are affecting that person's next 28 days. And if we tell them we can't get you in for a week, with fentanyl the way that it is, they may not be here in a week. A week may absolutely change their life. I think recovery is making a better choice for yourself today than you did yesterday. And recovery for me has meant trust of the people that I love. I always want to make sure that our door is open, and if somebody wants treatment that day, we're going to get them in that day, because that is the biggest decision that they may make. When a person decides that they're ready for treatment, it affects not just them, it affects their children, it affects their parents, it affects their community. Anything we can do to support that patient on day one is just gold. And that's why I choose to recover out loud. I respect everyone's right to remain anonymous, but also I'm thankful for those who recovered out loud so that I could see it, and I want to be the same beacon of hope for them.
The medications are really powerful. They're very good at reducing the chance of dying of an overdose death. They're very good at reducing the amount of illicit opioids people use. They've been shown to reduce participation in behaviors that transmit bloodborne infections, things like hepatitis C and HIV. The medications are great at those things. And one of the things that I think is just so powerful is to be able to offer any of the medications that are out there to somebody to help support them. But the medications don't do a lot of things, right? The medications don't teach people about their triggers. whether it's external stuff like specific street corners or times a day. They don't teach them about internal triggers, like how to handle negative emotions, whether it's anger or frustration or boredom. The medications don't help people learn to repair the relationships that in their lives that got damaged during the addiction. Medications can reduce craving. They don't eliminate it all the way. They don't teach people how to cope with craving when it comes up, if it's unexpected. This is where counseling comes in, right? This is what counseling does. Counseling really can help people with those skills and information that they need in order to be successful. And so the medication makes it so that people can engage in the counseling. I mean, somebody who's in active withdrawal is not going to be that receptive to learning new information. Somebody who's nodded out on drugs isn't going to be that receptive to new information. So the medications can kind of create the conditions that are necessary for people to participate in those other things that are really, really important to help them learn the things and practice the things that they need to be successful.
Life is so much better now. Like, I'm genuinely happy now. I still have struggles. I'm learning to deal with them every day, but I'm not miserable anymore. I'm genuinely happy now. After everything that I've been through, my drug abuse, my run-ins with the law, all that happened for a reason. I'm actually thankful for my drug addiction. It brought me here, brought me to meet these people. It showed me that I have a bigger purpose in my life.
For the longest time, we made this a moral issue where people who used substances or developed problems with them were seen as morally or spiritually defective. The stigma around this is such that it really makes people reluctant to seek care. And we know that because the National Survey of Drug Use and Health in this country shows us that. It shows that like upwards of 95% of people in this country who have a substance use disorder don't seek treatment for it. And one of the most common reasons why people don't seek treatment when they need it and recognize they need it is because they think that they should be able to handle this on their own. Nowhere else in medicine would you find people have that response to an illness that they know they have. Stigma is starting to, I think, to get addressed, and it's starting to change. People are starting to recognize that addiction is a disease and that we're making progress on this.
If you're here today and you're thinking about making that change, my best advice to you is make that first phone call.
BHG gave me a life again, and I'm so grateful for that.
Recovery is not a competition. It's not going to look the same for everybody, and healing is not linear. And just to remember that it takes the time it takes. And it may not be your first try. It may be your second try. Maybe BHG is your 5th try or 6th try. But to give that a chance to see if this is the time, and just to keep that hope alive.
Slips and relapse are just a part of the process. They're nothing for people to be ashamed about, nothing to feel guilty about. It's just part of this. It's kind of like if somebody had diabetes, sometimes their blood sugar is going to spike still, and people are going to make dietary decisions or things that sometimes cause that to happen, and that's not ever cause for an endocrinologist to say, oh, you're a terrible patient, I'm not going to treat you anymore. It's absolutely something that we need to expect, and we have to be ready for, to help people see those times when they slip or use. It's an opportunity to kind of figure out what more they need to kind of learn, what more they need to practice, what more they need to prepare for to reduce the chance of it happening again in the future. It also gives us a chance to figure out if the medication's at the right dose. The other important thing is, I think, to make a distinction between a slip and a relapse. Every relapse starts with a slip, but not every slip turns into a relapse. Somebody might use once and kind of say like, what am I doing? I don't want to be doing this, and stop it. And then we can kind of come in and kind of help process what happened. The danger is if somebody goes out and slips, and then what so frequently happens is they kind of go to this all or nothing thinking, and they're like, I was doing so well, now my recovery's not perfect, so I'm giving up. We don't want that to happen. I mean, it's kind of like if you bought a new car and it got a scratch on the door, you'd never say, well, it's not perfect, so I might as well drive it into a tree. You'd say like, okay, let's stop, let's buff the scratch out and keep driving. It's still a great car, you know?
One of the first things I learned was to write things down so you can reflect on them. And it's also, you can use it as a measurement to where you were a month ago, a year ago, 2 months ago. And another thing was just reading. Finding out, I'm a guy who I want to find out information, you know, and I just submerged myself into a lot of reading because I wanted to gather information to find out what was good for me. And I found out that what was good for me is not necessarily good for everybody else, but it works for me. I know that I can go and just get in a calm place, meditate and read, and it can calm me down so much.
One of the things that people have a lot of opinions about is that they've got strong opinions about how long somebody should be on these medications. And they kind of feel like, well, they should be on it for the minimum amount of time and it shouldn't be on for, forever or any of the rest of that. There's no data to support that belief, okay? No data. The federal government used to recommend people should be on it for at least 2 years. They then changed the recommendation to they should be on the medication as long as it is benefiting them, which is a much more sensible approach. As long as the medication is creating more value and benefiting their life more than it's detracting from it, we should make it available. Ultimately, what we can say is, and there are external research that show this as well, the longer somebody stays in treatment, the better they do. We have data that show that people's scores on the Brief Addiction Monitor continue to improve 5 years out. People at 5 years are doing better than people at 4 years. People at 4 years are doing better than people at 3 years. And so even when somebody's made really good progress, that progress gets more enduring and stronger the longer that they stay with it. As a result, we don't have an opinion on how long somebody should be on medication. As long as it's benefiting them, we're going to make it available.